you ever get sent home with one of these, chances are you're gonna have to do your own wound care. So wound care and pin care, same exact thing. You get to take care of it yourself. That means you get to make sure you stay healthy the whole time you keep that on. So I'm going to show you real quick how I do pin care, and hopefully it doesn't gross you out completely. First things first, get a pad, because get like a doggy pad or a wet pad or a little kid's pee pad, whatever you need to do. You're going to open that up because you do not want to get the cleaning solution or anything from your leg onto your bed. I like to use a pillow to bring it a little bit closer, so I'll put the pad over the pillow and then grab the metal and put it like that. So that way it's nice and snug underneath there. Let me try to move it closer. You want 4x4 gauze sponges. Open those up. You can get these at any medical supply store. These are non-sterile, but they come sterile-ish. Okay, I'm gonna grab a chunk of those. And then I have wound cleansers. I have a lot of this from previous wound issues. You can also use a mixture of hydrogen peroxide and water if you don't have this, or you may be able to find this also at a medical supply store. So you're gonna grab your 4x4, fold it in half, give it some depth, and then spray it on here. So just for an example, I'm gonna clean this pin up here. If it looks like it's got a little bit of cake scab stuff, feel free to soak this up and then leave it on the pin. And while you're leaving it on there, you can clean everything else. You're gonna just lightly, until you're used to how much pressure you need to put on this. I've done this for 3 months, so it took me a lot of time to realize how much pressure I could put on without it causing too much pain. I lightly do it at first. Just look at it and make sure you're getting it clean. Even if it hurts a little bit sometimes, you gotta do it because these pins have 100% chance of infection. It's basically just a race against time on whether it will get infected before you get it taken off or not. So it's up to you to decide if it's gonna get infected or not. So I will lightly wipe around. If there's anything else, sometimes I'll use like these frayed ends of the gauze to kind of brush out any debris that I can't get with the bulk of the gauze. And then do the pins, but also do your actual leg. Like scrub everything because everything is connected. It has to all be cleaned. So again, we're gonna grab the gauze, fold it over, get it nice and good and wet with the wound cleanser, and then find you a pin. And very carefully, like with 2 fingers, very lightly, twist around it and get it clean. If you cannot see the pin, sometimes you can do it by feel, but make sure you have someone look at it also. If you can't see the pin, like these I can see really well, but the ones on the other side of my leg, I just don't bend that way. I can't see if it's all the way clean, and so sometimes I'll blindly wipe around the pin, but have someone check it and maybe have them clean it if you can trust their abilities there for a little bit. So this one's got a little bit caked on it. It's not super happy right now, but it'll be fine because it's coming off tomorrow. I'm not gonna worry about it. But yeah, that is how you clean it. Very gently and carefully, but also very thoroughly. And the perk of doing your own wound care is if you notice something is kind of red and irritated and angry, instead of cleaning it every other day or every 3rd day, you can clean it every day to make sure that that infection and whatever is causing that irritation can be caught maybe before it's infected, because you may just have a piece of dead skin in there that's irritating it and it could lead to infection. But the perk is you don't have to wait to go to the hospital or the doctor's office to get it cleaned. You can clean it yourself. So use what the doctor told you. I use wound cleanser. The other thing they recommended was hydrogen peroxide and water mixed together. If you have a particularly fussy pin, you can use Q-tips to be able to try to clean out some of that gunk. So I have gone 3.5 months with no infection, and I think it's doing pretty good. I've got a rash, but it's okay. You have to keep an eye on your own stuff, let the doctors know whatever comes up. But yeah, that is how you clean a fixator. Slow and steady wins the race, but do it constantly, and don't be afraid to do it. And don't not do it because you're a chicken, because you're going to hate yourself afterwards. It's not worth it, believe me. So there you go. That's how you clean it. So here's an up-close wound care idea. So here we have the 4x4 folded over in half. Again, it's on a like a doggy pad so it doesn't get my pillow wet. I'll spray it down with wound cleanser. And then we're going to clean this pin right here. So very carefully and gently put the wet gauze around this pin. It's kind of hard to show it because I do it more by feel in a way. So it's a little red and angry. It's swollen from today, but that's kind of life. But you get cleaned around it as much as possible. If it ever looks like it has a lot of gunk that you want to really work on getting it out, I would suggest folding this over, getting it good and wet, and then wrapping around it and letting it sit for just a little bit, like just enough to clean these two pins, and then come back and swirl around it and clean it, because you want to keep it dry. You don't want it to be bad. So the rash is also, I would not suggest shaving your legs as much as it looks a lot better. Sometimes the end result is a really, really itchy rash, which you regret more than having hairy legs, I'm afraid. But that is how you clean it. You go around every single pin that way, scrub around it, and then also do like these open areas where there's nothing. Just scrub it all down. One of these per pin. Change them out, chuck them away, grab a new one. That's how you have to do it. Keep everything as sterile as you can. Wash your hands before, and gently do one pin per piece of gauze. If it's kind of extra gunky, 2 pieces of gauze. Like, be liberal with that gauze. We're not trying to be conservative here.